So the NETTER-1 study was published in this week's New England Journal of Medicine. It was the first randomized phase 3 study of a radio-labeled somatostatin analog. It looked at patients with midgut neuroendocrine tumors progressing on standard dose octreotide, randomized them to 4 cycles of lutetium dotatate versus high-dose octreotide 60 milligrams every 4 weeks. The primary endpoint was progression-free survival by central blinded radiology review, which is important to emphasize. And the trial did meet its primary endpoint. There was a 79% improvement in PFS on the lutetium arm. The median PFS was 8 months with high-dose octreotide. It was not met with PFS. At month 20, the rate of progression-free survival was 65% with lutetium versus roughly 10% with octreotide. So certainly a very clinically and statistically significant improvement in the primary endpoint. We also saw improvement in response rate, 18% with lutetium versus 3% with high-dose octreotide. And 18% is really the highest response rates that have been seen with a systemic agent in this disease. This is not a disease that generally responds to systemic treatment. So that was quite encouraging. With respect to overall survival, there were nearly twice as many deaths on the control arm versus the lutetium arm. It was a preliminary analysis of overall survival, so even though the p-value was 0.004, it was not yet statistically significant, and that needs to be confirmed on mature analysis. And with respect to response rate, the side effect profile was quite encouraging. There was only a 1% rate of grade 3 neutropenia, 2% rate of grade 3/4 thrombocytopenia, and no real evidence of renal toxicity. So encouraging efficacy and toxicity data.